Little baby one. There's the rest.
I feel I can actually move.
There it is. Hey, yo. We got some back issues, and it's on the hip, you said, correct? Is it back here, or is it back into the side? Okay. When did that start again?
Thursday.
Thursday,
Yes.
okay. What were you doing on Thursday that caused it? Nothing?
It just started hurting. And
Okay.
it just got worse and worse.
And this is the first time you've had that?
No, I've
You've
had
had it for a while, right?
Mm-hmm.
Okay. Now, a lot of times, you know, when we look at someone with a spine like yours, when these issues kind of are underlying, it doesn't take very much for something just to kind of go out. Many times I call it the straw that breaks the camel's back. I've had patients literally like crawl in the office. I'm like, what did you do? And they're like, I literally just turned over to pick up my cell phone, and then their back goes out.
Right.
I've had patients sneeze and like, oh, something happened, you know? It's just something that where basically if you have some instability underneath, you can just look and say, oh, something happened, right?
Mm-hmm.
And so you're feeling it more on the back over here.
Correct.
Okay. Anything else? I know we have jaw issues and some
My
other
neck
stuff.
right now is it's bothering
You're feeling
me. I
that?
have a really bad headache right now.
Where do you feel the headache at?
My head is just right here. Just all
The base
this.
of the skull?
Like right here.
And the neck pain, where do you feel the
Right.
neck pain? Right in this area.
Mhm.
How often do you get headaches?
Oh, often.
Okay, so regularly?
Yeah.
0 to 10, how bad is that headache right now?
I would say a 9.
And, okay, so it's pretty bad.
It's been hurting since yesterday.
Okay, usually when you get the headaches, are they usually in the back area?
Mm-hmm.
When you get the headaches, do you find that you wake up with the headaches, or is it usually like throughout the day you start to develop one?
No, there's been times that I wake up with the headache.
Okay,
Like
okay.
today I woke up with the headache.
Okay, so right off the bat, the first thing I'm looking at is you got a lot of swelling onto the upper back here. Now I know in your x-rays we look at those, we have a reverse curve happening in your neck, and it's lost a lot of that curvature, and so a lot of times that stress kind of focalizes on your upper back and on the lower part of the neck, and you get this stress right in this area.
Right.
In terms of your spine, I'm just looking at the differences from the right and then the left. You do notice that you do have more tension in this area here. This side, not as tight on this area. You do have a little bit of a divot, but this side just really, you can just tell it's all tense on that right side here. Now, in terms of where your pelvis is, I want to go ahead and scan your spine first, and then we're going to start pushing into the parts of the spine that might cause some areas of irritation there, okay?
Okay.
So let's take a look first and see what's going on. Now, the pain that you get here, does it go down into the legs?
Yes.
Okay. All the way down into your feet, or just to the back of the knee?
Like to my knee.
To the knee?
Mhm.
Okay. And did you say it's more so on the side of the knee or on the back of the knee?
I would say more like on the inside of the knee.
On the inside?
Mm-hmm.
Okay. All right, let's see what's going on here. So we're starting to see some of that stress at the base of the neck. Now, some people, they have a single minor issue in the neck. Some people, it's multiple, depending on how long the problem's been there for. You sleep on your back or on your stomach or on your
I
side?
sleep on my stomach.
Ooh.
I know.
Yeah, that's a big no-no for everyone.
I know.
Yeah, because if you sleep on your stomach, a lot of people, it's like, oh, but that's the most comfortable position for me. But unfortunately, when you sleep on your stomach, you're cranking your head over.
Correct.
And when you crank your head over, you're also twisting your hips because your leg has to stick out one side than the other. And so then you'll find some additional stress on the neck, additional stress on the mid-back, but for sure we're going to see the twisting in your pelvis. I don't know for certain, but it is possible that the hips, the way that they're rotated like that, could be from just sleeping on your stomach quite a bit. Yeah, you got some varicose veins going on over here too. So when there's a lot of inflammation in an area of the spine, you're going to start seeing these veins pop up. So they disappear. It's a very common sign. A lot of times when we start working on these areas and you see these veins kind of popping up like that, when the stress gets relieved off of that lower back or on any part of the spine, a lot of times these will start to go away as well. So we'll see what we can do about that. But we got some pressure up onto the top. So right there. So that's the upper part of the joint. So again, when your pelvis kind of goes out and then drops down, it's going to cause that to be inflamed right on the joint in there. I'm going to push down into the middle here.
Okay.
Is that sore right there?
Oh yeah.
Right there. And then one down below. Any pain here?
Oh yes.
Okay. And then on the left side here. Not too
That's
bad.
bad.
And then down here.
Oh, that one hurts.
Sore on that one.
Yeah.
Yeah, it makes sense. I mean, when that pelvis has that much rotation, it will cause significant issues on both sides, not just one. Can you stand on your feet again?
Yes.
All right, so go ahead and just close your eyes. You're going to march in place for me. And I'm just observing, seeing how things are doing. Okay, and relax there. Okay, so just looking at your feet here, Now, as your pelvis starts to rotate this way, what's going to happen is your feet will change a little bit. So what I'm noticing here is this foot's flared out just a little bit more. This one's rotating in this way. So what happens is when your pelvis, it starts to twist. When it twists, this foot oftentimes going this way will come in this way, but the opposite will start to go out this way. And so you'll see this one's flared out just a little bit more here. This one's a little bit straighter. So that's usually a sign that that pelvis, as it's twisting out like that, again, that's where you'll see the EX12 on there. That's going to be that rotation out, and that's kind of confirming what we're seeing on the x-ray. So we're going to have to work on that pelvis to see if I can bring that back in. It's going to take a while because it's been this way for some time, but if I can start bringing that pelvis, that's going to start to alleviate some of that pressure. Okay, let's have a seat. Here's 12, 11, 12, 11. Any pain there?
Yeah.
Okay, which is the worst? 11 or 12?
12.
1, 12. I'm going to bring you back just a little bit. Checking for the movement. Yeah, 11 moves pretty well. 12 is where it gets stuck there. So we're going to work on that 12 here as well. And then we got some stress down at the base of the neck, a little bit up on the top, but that's actually not my biggest concern, to be honest. 5, we have C6, 7, 6, 7. Any pain on that?
A little bit.
Which is the worst? If you had to say, would it be 7? Would you say 6?
7.
One, that's 7 right there. All right, you ready?
Yes.
All right, sounds good. So bring up the right arm. Just get a little seatbelt on just to stabilize. You bring the arm down. You're going to relax the shoulder, relax the neck, relax the body into the chair here. Now I want to go ahead and grab onto that C7. And again, because it's rotating to the left, we're going to get that tissue and pull it over to the right side to get that to come back into the position that it needs to, okay? And then from here, what I'm going to do, I'm just going to get you to relax just a little bit into the hand here. Just like that. This hand's going to just stabilize you back here. Now your job is just to relax. Let the shoulder go. Let all that stress go from the shoulders down into your arms, into the hands, and let it go from the hands into the legs, and from the legs into the feet. I'm just going to get a little bit of push here, okay? There you go. Good job.
That was awesome.
Good. I was glad. Bring up the right arm. All right, go and sit on that for me. All right, so let's see what we can do here. So we're going to contact right underneath onto that joint here. Again, it's rotating out and it's pulling down. I'm going to see if I can push that back into that position here, okay? Right there. And from here, I'm going to roll just a little bit. See if I can get that movement where it needs to. There you go. Relax there. A little bit of soreness, okay? There you are. A little baby one. One more time. Last one. There's the rest. Good job.
I feel I can actually move.
Okay.
It doesn't feel as tight.
Uh-huh. All right, so you're going to relax your arms, relax your shoulders. You're going to take a deep breath for me. And as you let it go, relax your belly down. A little bit of push. Ooh, that's really stuck. Okay. All right, let's see if I can get that little bit of push right on over here. Chin up a little higher. There you go. Deep breath one more time. Let it go. Relaxing the shoulders. That's what I'm looking for. Okay.
Mm-hmm.
All
It
right.
feels so good.
Good.
It's so good.
How's that upper mid back area doing?
It feels good.
Good.
I can't even explain it, but it feels good.
Yeah. All right, so we did 3 things for you, okay? So the first thing was your neck. You see how you lost that curvature down here? There's a lot of stress down at the base of the neck, and then as your mid-back comes up here, your spine goes into there. There should be a curve, a transition that happens. What happens is when your spine, it loses that curve, it starts to push back here. There's a lot of stress that's created in this area. So instead of having a nice curve like this, it gets pushed back, and all that stress starts to go into that upper back here, okay? So there should be a curvature that comes in, but because there's no curve, these discs, these joints, they're in trouble. So we're trying to push that back where it needs to be. When you lose the curvature, what happens is as the spine goes back this way, the muscles get pulled and they get tightened. And so that's where you'll see that stress can go up into the neck. You're going to see pulling up here, and that's where you're going to see some of the headaches happen as well. So that should start to resolve. However, if it's not, we're going to keep monitoring what's happening up on the top. We might need to work on that. But right now, my biggest concern is what's happening at the base of your neck, okay? Now, the second thing that we did was the rotation of your pelvis. That says EX 6, 12. Again, your pelvis is twisting out like this. You felt we got a chance to move that back into position. Now this is pretty significant in the amount of rotation there is. So what happens is I'm going to move that joint into position. It's been this way for a long time, so what's going to happen is going to pull back into that position that it was. So that's why we're having you on a treatment plan to get you in more consistent, because the more I get that joint back where it needs to be, it's going to want to hold there. Now over time we will get you some exercises, so then that way we can strengthen these areas. But right now my biggest thing is, can we get movement into that joint, getting it back in the position that it needs to be, and then we'll start to strengthen that area here. Okay. The last thing that we did was the mid back, right down in this area. Again, it should have more curvature in this area, but right about here is where it starts to lose the curvature, kind of stacks up the rest of the spine. So that's where you're going to see a lot of that inflammation and irritation in that area. So we worked on this area as well. Okay. So again, it's been this way for who knows how long.
Right.
When we go in there, start shifting some things around, a lot of patients can either, one, feel really great. Two, because it's been this way for such a long time, you may not feel much in the beginning, right? It's going to take some time. The third thing that people might experience is sometimes, because there's so much shifting happening, sometimes patients might feel a little bit worse before they get better. But most people over time, we start seeing some progress, okay? So we should expect to see some improvement in there. Ice is your best friend if you feel any soreness, okay? 15 to 20 minutes, get a nice pack, put a paper towel around it, ice those areas if you need it. So that's going to be pretty much it for today.
Perfect. Thank you.
You did so
That's
good.
so good.
It's a high
Thank you
five
so
moment,
much.
yeah.